Hello and welcome to Below the Hospital, an AME podcast on sterile processing and the issues that sterile processing technicians face today. I am your host, Garland-Rhea Grisby, Interim Assistant Director for Sterile Processing and Endoscope Service Manager at Kaiser Permanente. I'm also a long-standing AME member. In this podcast, I interview folks from around our industry about sterile processing and ask questions that I would consider are informative about our profession. Today, I have the pleasure of speaking with Melinda Benedict. Is it okay to call you Mindy?
Please do. Thank you.
All righty. Well, Mindy is the Director of Infection Prevention and Control at Olympus Corporation of the Americas. She's board certified in infection control. She has a background in biomedical science and is a certified endoscope reprocessor. She has also contributed to a number of AME guidance documents, most notably serving as co-chair of AME's Endoscope Reprocessing Working Group 84 during the production of the 2024 edition of AME TIR 99 for ultrasound probe processing. So, Mindy, just to get us started, tell me about the infection preventionist perspective. Like for SPD staff or scrub techs, what do you wish they knew about your work?
Yeah, thanks, Garland. I think the main thing I want people to know is that infection preventionists are allies. We're not auditors. And I think one thing I hear a lot in talking to customers is that the SPD or the scope reprocessing staff, they tend to kind of put their guard up when they hear that the infection preventionist or IP staff is going to come through. Because I think they think they're there to call them out or find out things they're doing wrong or just get them in trouble. And that's really not the case. IPs come in not to create more work, but really, and Olympus uses this tagline, but I think it's so true. They make people's lives healthier, safer, and more fulfilling. So the IPs are really there to come in as that third set of eyes. They put patient safety at the heart. They have that expertise. And to that end, they can really educate SPD and reprocessing staff about the IFUs, why they're there, and the best practices that are associated.
That is so true, because I remember when I first came in the sterile processing world, it was like, uh-oh, there's infection prevention. Here they come, right? And folks still have that same view. But I remember one of my mentors told me, they said, Garland, no, infection prevention, those are the folks that you want to partner with. And they said, look at it this way. They said, you're the nail, they're the hammer. So in any construction project of the sort, you need a hammer, you need a nail, and that's how you bring things together. And so from that moment, I looked at infection preventionists quite differently.
Yeah. I think it's great to be an ally with your IP, especially if you have an issue or a situation. Sometimes that infection preventionist can add a little gravitas, if you need a little support. So they're good people to make friends with. Absolutely.
Absolutely. So you mentioned IFUs. So for flexible versus non-flexible endoscopes, what's the difference for SPD staff? And what are some of the challenges that come with reprocessing different scope types?
I think the main difference is just the modality of sterilization, or the fact that, you do sterilize rigid scopes as your best practice standard. So you have the option for things like autoclavation for those rigid scopes and other methods of terminal sterilization. And that's not something right now that's you can really do with a flexible, reusable endoscope unless you're using ethylene oxide, at least the larger bodied flexible scopes. So I think flexible endoscopes still mostly reprocess using high-level disinfection. So I think the commonality between both rigid and flexible scopes is that no matter if you're using one type or the other, whether you're getting sterilized or it's getting high-level disinfected, you still have to do the manual cleaning according to the IFU. And this is another misconception that I hear once in a while, is that there maybe because you're sterilizing an instrument, then that means you don't have to do the manual cleaning as well. And that's absolutely not true. You have to remove any bioburden before you reprocess it, because sterilization, just like disinfection, cannot be effective unless you're using it on a clean instrument.
Thank you for that, because there is a lot of miscommunication out in the field today that are making those statements just as you mentioned. So again, make sure you understand that you have to do manual cleaning. You have to follow the manufacturer's instructions. So how do changes in endoscope design or technology affect how reprocessing and infection prevention teams do their work?
Yeah, that's a good question. And I think right now, a lot of times, at least in the flexible endoscopy world, which is where I live most of the time, when you think about new design, new technology, a lot of the times it doesn't actually always affect how you reprocess it. So, I do work for Olympus, so I can speak to Olympus. And most of our upgrades to our reusable scopes in recent years really have been improvements to things like visualization and ergonomics and handling of the scopes. So we're talking about things like optics. The computer chip on the inside of the scope becomes more advanced over time. Maybe things making it easier and more comfortable for the physician to handle the scope. So in the last years, the reprocessing in general has tended to stay relatively the same. Now that does differ a bit. We have specialized scopes like the duodenoscopes or the ultrasound scopes that will have some changes and do have some more steps because they do have that specialized distal end design. But again, I'm speaking in general terms. Usually new innovations are more related to the technologies used inside the scope than how it's reprocessed. But, I think, the most important thing for technicians, no matter how the technology and the design evolves over time, is, again, we're always going to go back to this, making sure you're adhering to the IFU. And the IFU may be updated here and there. So it is important that you have the most up-to-date IFU because we are starting to see changes to standards across the board around things like, and Garland, you know this as well as I do, drying, quality control, things like that. So you really want to make sure that you're in line no matter which manufacturer's equipment you're using.
Very important, right? We don't want the 1999 version IFU when was updated last year, right?
Exactly.
So that being the case, what are some important practices to help prevent HAIs linked to endoscope use or healthcare associated or acquired infections?
And just like I said, I'm always going to go back to this one, but it's worth mentioning. The IFUs are important. And the reason for that is really because the manufacturer has to validate the reprocessing instructions that are in the IFU before that device is cleared to sell in the United States. So as a manufacturer, we have to produce the scientific and laboratory reports and results that show that by following the IFUs as they're written, the end user can produce a safe and patient-ready scope. So I think, again, in general, following the IFU is really important. And also kind of a hot topic right now is timeliness. Yes. It's really important to make sure that you move that scope through the reprocessing journey as quickly as possible. And the IFUs don't always tackle this head on, but it's important to not let it sit. Don't let debris dry on your device because you might make reprocessing more difficult on yourself than you need to. So I think expanding on that as well, getting your processes down internally so that your staff is able to move the scopes through reprocessing in a timely manner is important. Your techs are under a lot of stress, but you have to make sure your processes are in place and they're empowered so that they can move those scopes through and adhere to the IFU.
Perfect. Yes. And also it's important to have the appropriate staffing so that you can move it through in a timely fashion, right? Exactly. If you need 5 employees, but you only have 1, well, we're going to run into some delayed processing. And as we know now, there are some updates that do not allow for delayed processing. So, yes, we live in interesting times.
Yep, exactly. And drying, another hot topic. I mentioned it before. If you live in the world of flexible endoscopes, you're hearing about it right now. So things like, are you drying your channels? When are you drying your channels? How are you drying your channels? Yes. All of this is really hot right now.
Yeah. So what role can infection preventionists play in the development of industry standards that are used during endoscope reprocessing?
I think where I see really great value in working with infection preventionists and in being one myself is that we really have the knowledge of the infectious disease process, of microorganisms, of epidemiology. So really, I consider that knowledge of the how and why of reprocessing. So for example, if a tech doesn't put gloves on when they're handling a clean scope, if a tech isn't wearing PPE, washing their hands, isn't drawing a channel correctly, the infection preventionist can understand how that actually affects patient safety going down the line. So your reprocessing tech may know that they're not supposed to do that. Your infection preventionist can help that tech understand why and what the ramifications of that action are. So I think it's a different perspective, right? It's a more general overviewing perspective that can really help the SPD and tech in doing their role and putting patient safety at the center of their job.
And that's good. See, and that's exactly why it's important to partner with infection preventionists so that we know the rationale. We know what can happen if we don't, not necessarily just, hey, don't do this. It's, hey, this is why, this is what the outcome could be if you don't. Thank you for sharing that.
Yeah, I think it's important to note that guidelines committees like AAMI, IPs can join those standards committees. If you are an expert on a specific topic that there is an AAMI standard for, such as endoscope reprocessing, you are able as an end user to register, to nominate yourself to be on a committee and then be on the front lines and be one of the people, along with Garland and I, really making these decisions and helping lead best practices. So that's a higher level thing, but something totally achievable.
Yes, and we talk about it all the time on this podcast about getting involved. So infection preventionists out there,
that's right.
Please join. Please join. Definitely will support the industry and how things go and how things are processed moving forward, even outside of the IFU.
Right.
So are there any best practices for processing scopes that you wish folks knew about? Now, these can be taken from AAMI documents that you've worked on or your own personal experience.
Yeah, I think number one, something to keep in mind before I go into this list is really, I think folks need to keep considering that if we don't have devices like reusable, flexible endoscopes, what's the other option for patients, right? These endoscopes replace open surgery with a minimally invasive procedure that can be done endoscopically. So I think it's important for techs to really remember how important their job is and doing it correctly, because think of what you're enabling for patients through your work. It's really important. But going off of that, again, I think this is the 6th time I've mentioned it, manual cleaning. It's everywhere. It is the step where you remove the most bioburden, which then can enable you to actually achieve really good high-level disinfection or sterilization if you're going that route. And this really does come down to the technicians, the SPD tech's competency and ability to get that debris off the instrument. And that's whether you're using a rigid device, a flexible device, any device. It doesn't have to be an endoscope at all, as well as accessories. I think people tend to focus on the endoscope and maybe forget about the accessories, but the accessories have their own IFU and their own reprocessing instructions that also have to be adhered to. So I want people to make sure they're not forgetting that. Also, kind of the nitty gritty, some things I hear about and see that people tend to be confused about are things like correct size brushes, correct dilution of detergent, this idea, and obviously, right, I'm a homeowner that more soap is more clean. That's not true here. You make sure you're using compatible chemistries. All those sorts of kind of very base steps that are in your IFU, don't forget about those. Make sure you're still adhering to the IFU, and not only the IFU for the scope, but again, if you have accessories, don't forget about those.
Yes, that's important. I remember, again, stretching back to when I first jumped into the field, I remember seeing folks just dump enzymatic in the water, right? The whole more is better. Absolutely wrong. Absolutely
Right.
wrong. We have to take into consideration that, again, these manufacturers designed and tested everything that they have, and it was approved with how they tested it. So we have to follow that. Yes. So last question. Does Amy have any additional guidance in the works relevant to endoscope reprocessing?
So yes, there's something really exciting that I'd love to talk about, and is that there's a new guidance in the pipeline, and this relates to Amy and also ISO. So there's a ISO standard being developed that is concentrating on sampling and culturing of flexible endoscopes. So that's brand new. The working group just had their first kickoff meeting a couple of months ago. And I think this is exciting because this idea of a global sampling and culturing, standard procedure was really developed out of a group of experts in this field who get together annually. And they look at hot topics in flexible endoscope reprocessing. And then they also look at the science and clinical evidence around what we do. So out of that meeting, this ISO standard was actually born because this group realized that the way people are sampling and culturing endoscopes on a global scale, not just in America, but in different countries as well, it's so different from the way they pull the sample from the scope to the neutralizer they use during the transportation method to the laboratory processes. It all differs from country to country and even from region to region to facility. I think that's really important to realize because if you're a facility that does sampling and culturing and you get your own results and you go out, whether it's to a peer-reviewed journal article or a friend's facilities results to try to compare, you can't compare your results to a study that was not comparable. So you need to be using a standardized, similar sampling and culturing process and protocol because all of these variables can affect results on your end. So we have to standardize it so we can kind of eke out the most data, the most patient pertinent data we can. So we're trying to work out a worldwide, it would be a voluntary standard so that everyone can be doing this the same way, and then we can compare data and really learn more.
That's awesome. I know Mary Ann Drosniak always says, you've seen one hospital, you've seen one hospital. Even if it's a sister facility, you can see how different things are done. Again, even within the same organization, just from one facility to the other. So yes, this document, I know I'm looking forward to it. That way we can all be on the same page and not just all in the same book. So,
yes.
Yeah. Well, Mindy, thank you for taking the time to sit and chat with us. I know you're busy, but we definitely appreciate it. Great topic. And looking forward to chatting with you soon and maybe again on Below the Hospital. So, folks, as usual, I hope this episode has been useful. We'll be back in 2 weeks with another episode. If you want to support the podcast, you can find us at Below the Hospital on Spotify, Apple Podcasts, YouTube, and Amy Array. Until then, see you when I see you.